Yeah. So when should we order for chest X-ray and spirometry is one of the questions I think which I have already mentioned in my talk. The underlying cause, if you think prolonged spirometry, again, if it's an older child and there are clinical signs suggestive that it could be asthma, then you should definitely go ahead and do a spirometry. What are the red flag signs in a coughing child that require urgent referral? So like we have seen, if it's especially if it's an acute case and if you think it's foreign body aspiration or epiglottitis or tracheitis, these are children where, you really need to be very, very vigilant about. And so they may need urgent admission and treatment, especially X-rays and bronchoscopy. The next question is, should nocturnal cough always raise suspicion of asthma? If ever, are antibiotics justified for cough? Anybody would like to answer that question? Dr. Ahmed, somebody has asked if should nocturnal cough always raise suspicion of asthma? And if ever, do we need to use antibiotics?
Actually, no need for antibiotics for nocturnal cough only, because antibiotics for a fever with high-grade fever and suspicion of bacterial infection after taking the specific and sensitive for the organism itself. Second, nocturnal cough highlighted for an asthmatic case, because in the night there is a bronchoconstriction which is naturally occurring, so it is highlighted for the asthmatics. But maybe another causes, for example, GERD, because we are going to take supine position, and supine position, one of the causes of gastroesophageal reflux. So if it is increasing with feeding or by taking supine, we should highlight it for the GERD, which is may present with asthmatics also. So long duration of nocturnal cough highlighted for high suspicious for the asthmatic case.
Right. I think the second question we have already answered, and the next question we have already answered, what duration of cough is acceptable before we initiate pharmacotherapy. What I would suggest is, immediately jumping on pharmacotherapy, I think underlying the cause, because you need to know what you're treating rather than, just symptomatically treating the cough without treating the underlying cause is not going to really subside the cough. And in viral URTI, I think as Dr. Paul has already mentioned, reassurance is enough. Yes, absolutely. Giving time to the patient and explaining the etiology being post-viral is very, very important. I think Dr. Komal, you can take this on, how could modern medicine and Ayurveda complement each other in managing pediatric cough?
Yes, absolutely. I mean, as I already mentioned, they are complementary to each other, because along with this modern medicines, if we use these herbal formulations which are having this anti-inflammatory expectorant actions, the proven ones like tulsi, zingiber, aloe vera with this rejuvenative properties, and safer options we can use in this pediatric cough management.
Yes. Now, sorry, maybe for my ignorance, because we've studied medication where we practice more of evidence-based medicine, right? Now, if you can highlight that, do you have research or evidence, or any standardization regarding using these Ayurvedic formulation in children? And also, you mentioned about respiratory immunity. Do you think these medications, is there any evidence which has shown that these, formulation help in improving cough or immunity?
Yes. Lot of research is going on and it's done on this herbal formulations. Like during my like aloe vera I have mentioned, or the zingiber which we mentioned, it has proven the immunomodulatory property. Gudici, this drug glycyrrhiza glabra. So the research has been done and the studies have been published. It's well established.
Okay. So the next question is, are any cough syrups recommended in children less than 2 years? I think we've already answered this question. So children have a lot of cough. Mostly it is because of viral infection and allergy. And yet many times these children get antibiotics. And how do you counsel parents for this? And what would your advice be for the doctors? And do we need to use antibiotics? I think Dr. Ahmed did mention about not using antibiotics. So Dr. Paul, what is your take on this? How do you think you need to counsel the parents, especially, if you think that it's been a cough, but otherwise a child is symptomatically doing well. Because as you know, it's a little, difficult for parents to actually see the child coughing through the night.
Yeah. As a practicing pediatrician, counseling parents is the most difficult thing. I'm sure all the pediatricians here would agree with that. But then I think with the years we have learned how to kind of explain things to them, and also ask them to look for the signs which they need to be really worried about, and then approach us. That's one way. Then the nighttime coughs, it can be really disturbing. So if the child is about 2 years, like we mentioned earlier, antitussives like the herbal antitussives like honey can be given, which can soothe the throat, and also symptomatic treatment like saline drops, humidifiers, and also warm liquids. All these things should work for the child. But if the things are not improving, then we need to look for other signs. Maybe the investigations may come into role at that time. If the child is developing a fever, or child is becoming breathless or lethargic, or there's some signs which we feel that the child is not doing well, then probably we need to investigate further and then treat the child accordingly. Otherwise, just based on parental anxiety, I don't think we need to start any antibiotics or unnecessary medications for the child, because ultimately they're going to come and thank you later on.
Yeah, so I think calming the parents is more important than calming the child.
Yeah.
Right.
Exactly.
So our combination of cough syrup very justified, and do they increase the risk of adverse effects? I think absolutely. We need to avoid using combination cough syrup. Here, first of all, we are debating the use of cough syrups, leave alone using them in combination. Then they would definitely increase the risk of adverse side effects. So, Dr. Ahmed, would you put light on how safe are these centrally acting antitussives in children? Have you ever used them?
Actually, I never used codeine as a central
Opioids or
antitussive.
morphine? Yeah.
Never. I never use it because it causes a lot of side effects. Even 5 milliliters can cause severe headache, nausea, vomiting, skin rash, constipation, gastritis, a lot of side effects. We should, as you mentioned, you should know the underlying cause for the cough, because the cough is self-limited. A lot of cough, for more than 70% to 80%, is self-limited. It goes by itself by 1-2 weeks. Just fluid, increase the fluid intakes, hydration, steam inhalation, honey, it's enough. But yeah, parents never converse about these medication. It should start them.
No,
Even
I think what you're saying is right. This is not really warranted using opioids, the centrally acting, like you rightly mentioned, they do come across with a lot of side effects. So Dr. Komal, I think you can take the next question. And Ayurveda is an ancient science, and in the management of cough through Ayurveda, I think this would probably be an extensive answer. How do you manage? Again, I am sure, like in Ayurvedic treatment, also you would go with what is the underlying cause, rather than just using cough syrup frivolously. It doesn't, it's not like one medication would suit every child. It probably also depends on the underlying cause that we are using. Correct?
Absolutely, ma'am. In Ayurveda also, they highlighted on the root cause, find out first the root cause of the problem, and then treat accordingly. So once it's not suit for all, it's individual as per the child.
Yes, and I think any of the panelists can answer this question as, do you recommend use of vitamin C management, and for how long? Like, is there any correlation, any use of vitamin C in the management?
actually nowadays vitamin C is not.
I don't think so. There has been, yeah.
Mostly placebos, I think.
Yeah. So I think we've covered most of the questions, Dr. Jay. If there are anything else, I think it's been a extremely wonderful and an eye-opening session when it comes to management of cough. Though it is one of the most common symptoms that we see is in our pediatric practice. It is one of the most complicated modality to treat, especially like we have mentioned, sometimes the parents' anxiety is it's far more than the underlying cause. So I think we have already mentioned about the take-home message, and I would thank Dr. Paul, Dr. Komal, and Dr. Ahmed for sharing their views and enlightening us on the various medications and the treatment options that we can perceive for children who have cough.